All right, hello and welcome back. We're going to be talking about the urinary system. And really the urinary system in our next sort of lecture group, which is pH and ions, are going to really work together. I just kind of broke them up for ease of sort of subject matter, but you'll see we'll talk about a few things in this lecture, which will then talk in much greater detail, sort of like the next sort of section. Okay, so with that, let's get going. All right, so we're talking about the urinary system, right? We're talking about our kidneys, the ureters, the urinary bladder, and the urethra, right? So you have two kidneys, and I think I mentioned this in the digestive tract video. So here is where your liver is. It's in this area, kind of comes across to this side, and due to the sort of shape of the liver, the right kidney is a little bit lower than your left kidney. The ureters are the tubes that are going to take the urine that is being formed in the kidney down to the bladder. And then the urethra is simply the tube that is going to take the urine from the bladder outside the body. Okay. The main job of your urinary system is to filter your blood and try to return most of the water and solutes to your bloodstream, right? So what we'll find, it's not so much unlike when you're washing something in the sink. You want to make sure that you're not losing things, I guess, down the drain that you want back, right? So that's gonna be part, but sometimes they kind of leak through, or they just kind of, somehow make it into the sink, I guess. Anyway, you're trying to get those back into your bloodstream. So again, you're not losing valuable nutrients and proteins, and even ions, depending on what it is that your body might need. All right, so we're gonna talk about the ureters, and then we're gonna talk about the bladder, and then we'll move into the kidney, because really that's where a lot of things are happening. So we're kind of working a little bit backwards, but it's going from simple to more complex. All right, so ureters, again, the tubes that are taking the urine from the kidneys down to the bladder. They're going to vary in length, depending on how tall the individual is and stuff like that. But in general, textbook number, they're about 10 to 12 inches long, and their diameter is anywhere from 1 to 10 millimeters. They extend from that renal pelvis area, obviously, to the bladder. These are also retroperitoneal, so they are behind that visceral peritoneum. And they enter the posterior wall of the bladder, so you can kind of see them coming down, and then they kind of show them translucently here at the back of the bladder, and then there's these little ureteral openings here at the bottom back of the bladder. Okay, so this valve, the openings are what's known as a physiological valve, meaning that it's not like the valves in the heart where there's actual flaps and stuff. But what happens is the bladder wall compresses the openings as it expands during filling. So as your bladder starts to fill, it'll compress the opening. And the flow, I think naturally we kind of think that, well, it's just gravity, right? Gravity is simply urine just flows down the ureter, sort of like, I don't know, like water flows down our esophagus or something like that. However, it's not true. The flow is resulting from peristalsis, so the same movement that's going to move food through your digestive tract is moving urine down the ureters, and this again makes sense for a couple of reasons. One is if there's a valve here, if we're just counting on gravity to take urine from from our kidneys down to our bladder, if the bladder's full, it wouldn't be able to add any more. It wouldn't be able to ever fill past the openings. So this peristalsis can, force more urine into your bladder as you're producing it. But also, if you happen to lay down or, any kind of an incline, again, if we're just counting on gravity, it would never make it down to your bladder. It would just kind of sit in your kidneys, and that's not good because you're constantly filtering your blood. So again, this peristalsis helps move urine down to your bladder. Think about very extreme case of that, astronauts, right? They're in weightlessness. If we didn't have this peristalsis, we probably would never even be able to go into space, because urine would never make it down to the bladder unless we had those peristaltic contractions, which is kind of a weird thing to think about, but it's true. All right, we'll be looking at the histology of both the ureters and, well, just the ureters, but it's similar in the ureters as well as the bladder. So we have our three layers that we've been talking about, the mucosa, the muscularis, and in this case it's adventitia, not serosa. The mucosa lining, you can see that it extends from here all the way back to about here. So all of that is the mucosa layer. This darker purpley color is going to be transitional epithelium, and all of this other tissue, the lighter pink, is going to be the lamina propria, again, that loose areolar connective tissue. You can see the muscularis layer going around here. And then again, that's what's allowing for the peristaltic contractions to occur. And then you really can't see the adventitia very well, but that's after this muscularis layer. Now, when we talk about the bladder, obviously hollow, unless it's filled with urine. It's distensible, meaning that it can expand. I guess it can distend. So sort of like your stomach would be considered distensible as well, because it can expand. And again, kind of textbook capacity numbers. You can hold anywhere from 700 to 800 milliliters. Clearly, sometimes it feels like it's more. And for some, again, this will depend on individual variation in size and stuff like that. Some people have larger bladders, some have smaller, so there's always that. And then you have this area called the trigone. It's simply this area, kind of sort of the muscle fibers run a slightly different direction, so it gives it this triangular shape. Basically, the borders are the ureteral openings and then the opening to the urethra. So basically where the two ureters are coming in, and then where the urethra is, that makes up this trigone area. You may have heard of the term micturition, you may not have. Sometimes in hospitals, they'll refer to urination as voiding. You know, like a patient had difficulty voiding their bladder, for example. Micturition is exactly the same sciencey word. So if you're ever like wanting to impress somebody, you could always say, "Yes, excuse me, I must go and micturate." You would never say that ever, but you know, if someone ever does, like on Jeopardy or something, you know what they're talking about, okay? You have stretch receptors in the bladder, and they're going to, as they stretch, as they fill with urine, they're going to send signals to the brain, basically saying, "Oh, you should start looking for a bathroom or other suitable place to void and or micturate." Void your bladder and or micturate, because this is going to get urgent pretty soon. And then obviously those signals are going to increase with the ever-increasing volume in the bladder. There is, thankfully, conscious control of the external sphincter. They're, again, kind of very similar setup to the way we saw like the anal canal kind of working. There's voluntary and then involuntary muscles as well. And as I mentioned, your cerebral cortex can override your sort of like lower brainstem kind of area that would also regulate your urinary patterns. So again, if you're kind of sitting somewhere and you're like, "Oh, I gotta go," you're like, "Oh, no, not here. I will have to wait until I get home," you know? So you do have that, obviously, conscious control. So kind of a fun way to learn a little bit more about the bladder. So our bladders, once the urine gets down to them, even if it's very dilute urine, we cannot reabsorb any more water from our bladders, okay? The only place we can reabsorb any water is going to be in the kidneys. So once it's in the bladder, it's in the bladder. It doesn't matter if you're dehydrating out in the desert and your bladder is full, your body is not reabsorbing any water from there. Okay, now that is not like some other animals. So these two here are desert tortoises, and these are two males fighting, and this guy's losing here. And what they kind of do is they use their bladders as their canteens. So during the wet monsoon months, where water is plentiful, they will drink a lot of water, really fill up their bladders, and then their body is able to reabsorb water from there. So they ask that, if you happen to come across a desert tortoise as you're out and about, do not just pick it up, because its natural instinct is to void its bladder and or micturate all over you. And basically what you've done is kind of dumped out its canteen. And if you just put it down and let it go, yeah, it hasn't died yet, but it's gonna die soon because it has no access to water. It's in the desert, right? And it's gonna die a long, slow death by dehydration. So, don't pick up tortoises in the wild, I guess. And if you do and they void their bladders, make sure you provide them with lots of water so that they can refill it. And this is an Australian water toad. It has a couple of different names, but that's one of the common ones. These guys, you may have watched some sort of nature special on them. They also do the same thing. They use their bladders as a canteen, but not only that, the Aboriginals in Australia use their bladders as a canteen. So these are the frogs that when it's the wet season, they come out, they eat a lot of flies, they drink a lot of water, they mate real fast, and then they kind of bury themselves in the mud, right? We've probably seen those. Anyway, they bury themselves down in the mud, and the Aboriginals, as they're kind of crossing the deserts of Australia, they can recognize like what that dried mud area looks like where one of these guys has buried itself. Well, they dig them up and they kind of squeeze them, and they drink the frog pee, which is really it's just water. So it's kind of like nature's little aquapod. So helpful news if you're ever stranded out in the Australian outback. Anyway, kind of cool. All right, let's talk about the urethra a little bit. So male on top, female down below. So the urethra again is going to be that the tube that's going to take urine from the bladder out the body. So in the female here, you'll notice the uterus is right directly on top of the bladder, and then the urethra is clearly much shorter in the female than it is in the male. So a couple of things to note here as far as the differences go. Again, you'll notice the uterus is right on top of the bladder. This is one of the reasons why pregnant women have to go to the bathroom a lot, because you basically have, a bowling ball sitting on your bladder, compressing it so it cannot hold as much urine as it once did. Baby kicks the bladder, you gotta go. But the shortness of the tube also predisposes women to urinary tract infections. So if there are any bacteria, the bacteria don't have to go quite as far up to the bladder as they would in a male, right? So it's a longer trip, so it's more likely that the bacteria either don't make it, the body's immune system kind of destroys them, or they're simply voided out of the body during, micturition. The other thing that will contribute to urinary tract infections in females is that the anal canal is, in closer proximity to the opening of the urethra, and it's easier to cross-contaminate from bacteria from the digestive tract. It's easier to cross-contaminate the urethra with bacteria from the digestive tract, whereas in males, obviously the entrance to urethra is much further away from the anal canal, much harder to cross-contaminate that way. Not impossible, but less likely. So men tend to enjoy urinary tract infections at a less frequency than females. All right. Before I get into functions of the kidney, we're already at about 13 minutes. So I'm going to stop this video here, and then we'll get on to the actual kidney. All right. I will talk to you guys